slides having lumen and diagnosed by low power, decalcified compact bone, large-sized elastic artery, an example, aorta. Decalcified compact bone. By naked eye and eyepiece, it is a round red ribbon showing a red area in the center, which represents the bone marrow. By low power, osteocytes are seen present in lacunae arranged in bony lamellae, forming Haversian system. Decalcified compact bone. By naked eye and eyepiece, it is a round red ribbon showing a red area in the center, which represents the bone marrow. By low power, osteocytes are seen present in lacunae arranged in bony lamellae, forming Haversian system. Aorta. By naked eye and eyepiece, has thick wall and wide lumen. By low power, aorta has thick media, rich in elastic fibers, which appear rose red and wavy. Adventitia is characterized by the presence of small blood vessels, vasa vasorum, for nourishment of the thick wall of aorta. Other slides having lumen and diagnosed by low power. Large-sized vein, an example, inferior vena cava. Trachea. Inferior vena cava, a large-sized vein. By naked eye and eyepiece, it has a thin, irregular, collapsed wall and wide lumen. By low power, it shows thin media and thick adventitia, containing bundles of longitudinal smooth muscle fibers. Trachea. By naked eye and eyepiece, has wide lumen and C-shaped hyaline cartilage, blue in color. By low power, the mucosa is lined with pseudostratified columnar ciliated epithelium with goblet cells and supporting layer containing C-shaped hyaline cartilage completed posteriorly with trachealis muscle. Small-sized sections diagnosed by low power. Moderator bend, an example of the conducting system of the heart. Nerve trunk, spinal ganglia, sympathetic ganglia, basilar artery, an example of specialized medium-sized artery. Medium-sized artery and vein. An example of the conducting system of the heart, moderator band. By the naked eye, transverse section of the moderator band is a small rounded structure. By the eyepiece, it shows part of cardiac muscle fibers darkly stained at one side and Purkinje muscle fibers together with fat cells lightly stained at the other side. By low power, moderator band shows TS of cardiac muscle fibers with central rounded nuclei and darkly stained at one side, and Purkinje muscle fibers large size, pale color with vacuolated cytoplasm and the presence of fat cells at the other side. Peripheral nerve trunk. By naked eye and eyepiece appears as a small spot. By low power, myelinated nerve fibers appearing as red circles are grouped in bundles, separated by connective tissue perineurium. The whole trunk is surrounded by connective tissue epineurium. Spinal ganglia. stained with hematoxylin and eosine. By naked eye and eyepiece, it appears as a small red spot. By low power, unipolar rounded nerve cells of variable sizes are arranged in groups or rows, mainly under the capsule, separated by excessive thick myelinated nerve fibers. Sympathetic ganglia. By naked eye and eyepiece, it is also a small spot. By low power, multiple uniform small-sized nerve cells are scattered in the section, separated by scanty nerve fibers. Basilar artery. By eyepiece, it is a small-sized section with a lumen. By low power, it has thin wall and wide lumen, similar to veins, but characterized by the presence of well-developed internal elastic lamina. Medium-sized artery and vein. By naked eye and eyepiece, it is a small tissue having lumen. By low power, the artery is characterized by thick wall and narrow lumen, while the vein is characterized by thin wall and wide lumen, and sometimes it may contain blood. Coronary artery. By eyepiece, it is a small-sized section with a lumen. By low power, it has thick intima containing longitudinal smooth muscle fibers in the subendothelial layer, thin media and thin adventitia. It is characterized by the presence of well-developed internal and external elastic lamina. These elastic laminae prevent occlusion of the vessel during contraction of the heart, cardiac systole.